Let's get started. Thank you, everybody, for joining today. Today, Dr. Farr is going to talk about part two of her seminar, Writing for Scientific Publication, which is being offered as a part of Office of Research seminar series, Tools and Resources for Navigating Health Sciences Research Seminar Series. Can you advance the slide? I would like to thank Research Seminar Planning Committee, including Dr. Coles, myself, Karen, Kathleen, and Molly. And here are some disclosures. Dr. Fard has no conflict of interest in relation to this presentation, and this webinar was organized by Korean School of Medicine at UNLV Office of Research in order to provide learning opportunities for all of you. And here is some important information. This presentation has been created for educational purposes only, and we will share a PDF version with all of you after this presentation. And if you have any questions, please reserve those questions for the end. And feel free to unmute yourself and ask question directly, or you can post your questions in the chat box so that we can see and we can direct those questions to Dr. Farr. And we will be sending out one post-webinar email with the PDF attached as well as evaluation survey. And we would highly encourage you to take the survey so that we would know what other topics you want us to cover in the future sessions. If you have any follow-up questions, please email to our generic email address. And this activity is CME approved. If you are a physician, after taking the survey, you will be able to download your CME certificate for 1 credit hour. And if you are non-physician, you are able to download general certificate of attendance through our CME survey. And here is some important consideration for you. If you want to include in your promotion package or in your continuing education activities, consider to include this activity in your interfolio under additional training session. And for admin faculty, we suggest adding this activity to your annual evaluation. And this is my favorite part. I would like to welcome Dr. Farr. And Dr. Farr, thank you so much for your commitment to the Office of Research. It's my honor to introduce Dr. Farr, who is a professor in the School of Public Health, Environmental and Occupational Health Department. Her research interests include disparities in healthcare access and health service utilization of a vulnerable population, particularly sexual and gender minorities, disease disparities, including HIV, mental health, and chronic diseases. She also looked at barriers that impede and facilitators that enhance healthy behaviors, such as HIV testing, preventive care, and disease prevention. She also looked at the use of social marketing to promote health and the intersection of sport, physical activity, health, and using sport to advance health, and especially among women. Floor is all yours, Dr. Farr.
Great. Thank you, Dr. Batra, for that introduction. As Dr. Batra said, this is part 2 of the Writing for Scientific Publication. Last week, we talked about, or a couple weeks ago, we talked about writing an introduction and discussion and what is scientific and technical writing. This week, we'll continue on that, and we'll talk about specifically how to write a methods section. So how to craft your methods section that's comprehensive for your scientific publication for both clinicians and research audiences. Then we're going to also talk about how to write a results section and how to not only write the results section that will be useful for clinical patient care and for research, but also how to visualize the presentation of your results. So we'll talk about a little bit about tables and figures. We'll also talk a little bit about writing titles and abstracts today. So have a lot to cover, and we'll just jump right in and get started. As I said last week, a lot of this information comes from a book that I use in my technical and scientific writing class, EOH 709, if any of you are interested in taking that whole semester long. The cover that you see on the screen is the 6th edition. The authors are now on their 8th edition of this book, but it's a very useful book and one that I recommend, and a lot of my students take me up on that they purchase for the scientific writing class. They keep it. I know mine has coffee ring stains and dog ear pages and paper clips and all kinds of stuff, sticky notes on it because I use it quite often. And also, part of what I'm talking about today came from the professor who used to teach technical writing, Dr. Mark Butner from the School of Public Health. So it's always important to give credit where credit's due. Last week, we talked a little bit about this anatomy of a scientific paper. You could think of it as anatomy of a manuscript, a peer review article, your thesis, your dissertation. It's all basically the same anatomy, just how big the different sections will be will depend on what you're doing. Dissertation will be much bigger than a peer review article. But all of these start with an introduction section in which you introduce the information to your readers and give them background about what is known or not known about that topic. So the introduction usually starts with a big opening statement. Why is this study important? And a couple of weeks ago, I talked about, I do a lot of work in HIV testing and HIV prevention. And so a big opening statement from my research might be that globally, 37 million people are infected with HIV. We talked 2 weeks ago about then how we funnel the introduction down to our purpose statement. So I'm not going to review all of that tonight. Tonight, we're going to start off sort of talking about the methods, results. Then 2 weeks ago, we talked about how to write the discussion, right? You start with your most important or most interesting finding, and then you kind of funnel out to your big closing statement. What did we learn from your study? I think something important to keep in mind is that you can really start anywhere on this anatomy of a manuscript whenever you're doing your technical or scientific writing. I have adapted my writing style more that of course, I have my statement on my purpose or my purpose of the study. That's my, research question. What am I trying to do? What am I trying to answer? But a lot of times after that, I will be doing my study, right? So I'll write my methods, I'll write my results. And then based on my results, I will then think about what should I include in my introduction, what should I include in my discussion, because those two things should work together as a pair, as we talked about 2 weeks ago. So you can start anywhere and build momentum in your writing. Don't let trying to think of the first sentence of the first paragraph of the introduction slow you down and bog you down and give you writer's block. As I said, we're going to talk about methods. We're talking more specifically tonight about materials and methods and results section. So the materials and methods section is a complete description of everything that you did in your study. It's written in the past tense, even if you just finished it, even if you just did that last thing of your methods, it's in the past. So it's written in the past tense. You want to be really clear and precise in your methods section because a reader should be able to read your methods section and then replicate your study, right? So if we do a study here in Clark County, Nevada, and someone says, I wonder if we would find that same phenomenon in New York City, New York, right? They should be able to read what we did and then replicate our study in a different location. Or if we did a study today and we wanted to know, maybe in 5 years, we want to know, have things changed? Well, there's been so many changes in the economy or, pre-post pandemic or something like that, right? We need to be precise so that if sometime in the future someone wants to replicate our study, to understand how things have changed, right? We want to make sure that we describe the procedures that we perform. I like to think of it sort of like a recipe, right? In chronological order. So, first you get your IRB approval, then you recruit your subjects, then you give them the survey, then you analyze your data. Chronologically, how did you set up your study? How was your study performed? You want to give that information to the reader. In general, the method section is broken up into subsections. If it makes sense, you might think about including these subsections. So what was your experimental design, right? Did you do a clinical trial? Did you do a focus group? Was it a cross-sectional survey? Did you do a cohort and watch them over time? You want to tell your reader what sort of an experimental design did you use for your study. We also need to tell them when and where our study was performed, so the setting and the time period that we performed our study. Who or what did we study? So what was our population or what was our sample? How did we, what instruments did we use to collect our data, or did we go out and maybe measure microorganisms and use pipettes and culture dishes and PCR and things like that? Or did we use a survey? So we want to tell the reader about that. How were our data collected, or what were our data sources? What variables did we use in our study? What was our dependent variable? What were our independent variables? Give information about that. even to the point of were they continuous variables, were they categorical variables, dichotomous variables, so that the reader can understand why you selected the data analysis or the statistical analysis that you did, and then you end your method section with your data analysis or statistical analysis. So the setting, where were the data collected? So where were the data collected, or where was your study conducted? You want to be specific about that. You can include things like if we're going out to Lake Mead and we're sampling the water for chloroforming units or microorganisms, right? We can even include something like a map to show exactly where we went to those sites to get that information. We can include tables. So I know a lot of you are in medicine, so maybe you're doing a study and you're looking at ICD-10 codes, and so you want to say, okay, here were the 10 codes that we use, and this is what the code means. You might want to use a table. You can use a floor plan. You can use any sort of graphics if you want in your method section, again, to give the reader a better idea about where your data were collected or where your study was conducted. You also want to talk about when your data were collected. There may be a specific reason or season for collecting your data. So if you're doing a study on the flu influenza, you may pick some points when we know that the flu, even though it's endemic, it's going to be low. We might pick some points when we think that the flu is going to be high. But we want to give those specific dates, times, reasons, things like that. We may do a study that's just at a certain point of time, maybe you just collected survey data in 1 week. You want to give that information about that timeline. Maybe you collected data over an entire year, right? You want to give that information as well. You want to tell the reader how you collected your data, and here it's important to give details, as much details as you can, again, so that your reader can take your information and replicate the study if they want to, but then also like they can think about how you did what you did, and on their own, in their own mind, say, was that appropriate? Was that an appropriate way to collect the data? And if you give enough detail, they'll be able to be assured that it was. Who were your participants? How were they recruited? Who was included? Who was excluded in your study? Or if you're collecting samples, how did you collect your samples? Right? Where did you go? What instruments did you use? Information like that. If you used instrumentation, you want to give the names of the instruments that you used and the model number, if appropriate, the manufacturer, distributor. If you use a validated survey, you want to give the reader information about that survey. So who created the survey? How did they validate it? How did they ensure that it's reliable? You want to give that information. What was the Cronbach's alpha number? Things like that. If you create your own survey, sometimes there's not a survey out there in the world that is going to measure exactly what you want to measure. So you want to tell your reader how you created your survey. Did you use a panel of experts to review the survey? Did you pilot test it to check for validity and reliability? Again, give all of that information so that the reader has a really good understanding of how you developed your survey. You want to include, if applicable, not every study will include equipment that needs to be cleaned, but if you do have equipment that needs to be cleaned, tell your reader how you did that. If you include instrumentation in your study that needs to be calibrated, how did you calibrate your instrumentation? So if you were taking instruments out to the field, did you calibrate them in lab and then take them out to the field and do your testing, or did you calibrate them on ground? Like if we're doing weight measurements, say BMI measurements, and we're using a digital scale, maybe we calibrate that scale each morning, right? Again, we want to tell the reader that sort of information. If we have samples that we're going to be analyzing in our study, we want to make sure that we provide information about the instruments that we use to analyze the samples and supply detail about the entire procedure about how you analyze your samples. Again, you may culture something, you may have to then remove the cultures, put them on slides, use PCR, whatever that is, right? You want to give your reader that sort of information. Typically, the methods section ends with your statistical analysis, which is great because you sort of end with your statistical analysis and then move into the discussion of your results, right? So that's kind of a natural, good way to flow from your methods to your results section. And the statistical analysis section, you want to describe, again, what was your independent variable? What was your dependent variable? What were your independent variables? What sort of statistics did you use to analyze your data? So if you had continuous variables, maybe you did multiple linear regression. If you have dichotomous variables, maybe you use logistic regression, whatever that is. And typically we end the statistical analysis part, talking about our software. So did you use SPSS, SAS, R, Python? What did you use to analyze your data? A well-written and detailed method section is super critical for our technical and scientific writing. If we do a poor job of describing or explaining our experimental design, or how we collected the data, how we recruited subjects, how we analyzed the data, it really will call into question the validity of your study, and we don't want that, right? You've done all of this work to conduct your study, and we don't want just a poorly written method section to have the reader questioning, yeah, is this really a valid study? Again, I want to emphasize that it is important. It's okay. It's perfectly okay to use tables, figures, graphs, maps, whatever in your method section to cut down on the number of words in the text. We're going to talk a little bit in the results section how tables and figures draw the attention of the reader, and sometimes a picture's worth 1,000 words. So sometimes you can cut down the text in your method section by including a table or a figure. Okay, so from our method section, again, we conclude with our statistical analysis, then we can move into our results section. The introduction and the method section of an article or your thesis or dissertation tell the reader why you did the study and how you got your results. The discussion tells the reader what your results mean. The results section tell your reader what you found in your study, and it's the most important part of your study. That's why they're reading it. They want to know what you found in your study. The results is written in the past tense. Again, even if you just finished doing your data analysis, it's in the past. So we write the results section in the past tense. We want to present relative representative data in our results section. We don't need to go on and on and on and include every single variable, even things that aren't significant, in our results section. We want to think about this. So the compulsion to include everything, leave nothing out, does not prove that one has unlimited information. It proves that one lacks discrimination or the ability to discern what is important and what is not. So rather than overwhelming our reader with a bunch of text, again, talking about, here's what was significant, here's what wasn't significant, it's better, instead of having them have the googly eyes on the left of the screen, to have the feeling when they read your results section. You include some text and then a figure. You include some text and then a table. You include some text and then maybe some bullet points. But you want to break that up and use tables and figures to present your data in your results section. So if you only have a few results to provide, for example, if we're just doing a simple linear regression, if we were to make a table out of that, it might be 4 or 5 columns and 2 rows. That would be a pretty small table, right? The first row would be the headings and the second row would be the numbers. Rather, if you have that little bit of information or those few results, then you can simply write that into a text. Like this, there's a regression model was significant, explained 11% of the variance in the number of barriers. ADA knowledge was significant in the model, and the regression equation generated from the regression was X, Y, and Z, right? Really simple. But if we're providing numerous results, maybe we had several variables that we were analyzing in our logistic regression, right? Then we'd want to include that in a table. Again, it's easier. It draws the attention of the reader. It's easier to understand. I can look at it and go, okay, here are the significant p-values, and based on the significance, I want to know what the odds ratios were for those variables at predicting the outcome, right? It's much easier to grasp in our minds, putting that information into a table. So the advantages of graphics, let's talk about that just for a little bit while we're on the results section. Again, graphics, so tables and figures, are more interesting to look at than to just read words in text. Again, a picture's worth 1,000 words. Now, a lot of times journals have a limited number of words that you can have in a manuscript, like 3,000 is pretty common, 3,000 to 3,500 in health sciences. So we want to be very precise and precious with the words that we use. It's easier to present data in tables than it is to write it out in text, especially if we have a lot of data. So that previous table that I showed you, that would take a lot of words to write all of that out. Again, both tables and figures attract the attention of the reader. We can have emphasis whenever we use graphics. Like if we really want something to pop out and stand out to the reader, we can color that in red, right? And have everything else be a little bit muted color to really emphasize, like, this is really important for you to look at. Requires less space And they're really important for numerical and scientific information, for really understanding like statistical information. Again, what is the p-value? What is the odds ratio? What is the f-test? It's important to put that sort of information into a table. So how do we decide? Do we use a table or do we use a figure? Tables are great if we have information that is either numbers or text that fits nicely into labeled columns. So again, a couple slides ago, we looked at a table. So we had the odds ratios going down. We had the p-value going down. We had the variables going down, right? We had these things listed down in columns. The thing to remember about tables is that they do not show trends or relationships. So if we want to show trends over time, a table would not be the best way to show that. Tables are really good when we want the reader to be able to to be able to see exact numbers. If I want my reader to know that the odds of experiencing mortality from COVID infection were 5 times greater for people who had not received a vaccine, or 5.86 times greater for people who had not received a COVID vaccine, then I want them to see that 0.86. It's easier to put that on a table than to have it on a graphic and someone's going, okay, it looks like the line goes somewhere between 5 and 6, but I'm not exactly sure where that is. If we want them to be able to say exact numbers, it's important that we put that information into tables. Figures are great ways to provide a visual representation of the results. They're really good for showing trends and relationships. So again, if you want to show how BMI has increased over time, right? We might want to do a bar graph showing how BMI has increased over time. Here's 2 examples. On the top, it's important that the person reading this be able to see what variable provided the greatest weight towards psychological distress or suicidal thoughts or suicidal attempts in this study. So it's good to have that in a bar graph so you can say, okay, wow, that really jumps out at me, that top bar. Again, more precise numbers, if we want them to be able to say the exact p-value or the odds ratio, that's better to put into a table. One more thing about figures we can use in combination. So we can include, we can combine a line graph and a bar graph and include that as one figure. So on this figure that you're looking at, we're looking at the world population. So the bar graph is world population from 1950, and then what we estimate it's going to be in 2050. So that's the line graph. That's the bar graphs. The line graphs, you can see that the sort of gold color is the urban population in billions, and the green color is rural population in billions. So from this figure, pictures worth 1,000 words, right? We can see that the world population is expected to continue to increase. But the proportion of the world population who lives in urban settings is going to be much greater than those who live in rural settings as we continue on in time. So we're seeing that there's a crossover around 2010 when more people started living in rural environments rather than rural environments. So we can give a lot of information on a figure. The results, short and sweet. We are not there to explain our results. We're just there to provide our results. Again, it's the most important section of your manuscript, but it's often the shortest section of the manuscript, especially if it follows a really well-written method section and it's followed by a really well-written method section and it precedes a really well-written discussion section. We want it to be crystal clear, simply stated. We don't need to use a lot of confusing words or symbolism or anything like that. This is the new knowledge that we're presenting to the world. And so it's really important that our paper be clear and simple and concise, and that we leave no room for confusion in our results section. In our results section, we want to avoid putting in words what is apparent on a graph or a table. Even worse, we certainly do not want to put in words everything that's on a graph or a table. Rather, it's important in your results section to say, maybe here are the significant variables. Go look at the table for the rest of the information. Here's what I really want you to grasp from the table, but go look at the table for that information. Again, the results section is just a presentation of the results. It is not an interpretation of the results. It's typical that we put our results section into some sort of a logical order sequence. Sometimes we can use subheadings, sometimes we don't use subheadings. Sometimes it depends on the journal. Sometimes it depends on the number of results that you have in those different subheadings. Typically, we follow the sequencing that we stated in our data analysis, right? So here's an example of this. So in the statistical analysis portion of the methods, first we say that we're going to do the descriptive statistics, then we're going to look at the qualitative data for knowledge of the ADA, then we're going to do a chi-square analysis to look at differences in accommodation. So that was in the method section. Now we're in our results section. So the first subheading is the descriptive characteristics. That's the first thing we said that we're going to compute. That's the first thing that we present in the results. The second thing we said that we're going to compute or do is the qualitative analysis. So the second subheading is a qualitative analysis. The third thing that we said that we're going to do was the chi-squared analysis for differences in accommodation. The third thing in the results is differences in accommodation. So we followed that format. Again, in the results section, you want to lead or refer your reader to the graphics. You would never just want to put a table or figure in your results section without saying anything about it, right? You want to have a paragraph, say what's important that the reader needs to go look at in your table or figure, then put your table or figure. Then have a paragraph for the next table or figure, say what's important, and then tell your reader to go look at that table or figure. In the results section, we don't want to give too much detail in text. So you can see this first bullet talking about the high temperatures for 16 days. So then we put 16 temperatures and then refer them to table 1. Well, table 1 has all those temperatures, so we don't need to have them all. Maybe instead we would want to say the average daily high temperature was this. Go look at table 1 for all of the daily temperatures. Or we may say that the range of temperatures over the 16 days was between 103 and 113. Go look at table 1 for all of the temperatures. You don't need to put all of that into text. We also want to avoid excessively long or complicated presentations of data. So in this first example, the concentration of fungal spores before, during, and after human activity ranged from 1.5 10 to the third, 5.9 10 to the fifth, 2.3 10 to the 10th. Now I have to stop and think, okay, 10, what's the greatest? 10 to the 7th is the greatest. And where did that fall in the sequence? Oh, that was after human activity. Better to say the highest concentration of fungal spores were measured after human activity. Go look at table number 1 to see the rest of the information. Okay, we're going to transition here from talking about results and methods. So we talked about the introduction, the discussion. Last time we talked about methods and results. I want to spend a little bit of time talking about table titles and abstracts because those are really important. It's really important that we put a lot of thought into these things. Titles are often written at the very end. I know I still sort of have a habit of doing that. You know, you write your paper and it's like, oh, I have to think of a title before I can submit this and just hurry up and think of a title. And that's really not the best way to do it. And I'm going to give you some tips or a tool that you can use to come up with a really good title for your manuscript so that it can be found by people who need your information to be able to read to help them maybe make clinical decisions or in their public health programs. So good title has as few words as possible, but still reflects the content of your paper. So you want to be concise. Typically around 12 to 13 words is a good length for a title. Sometimes it's a little bit longer, sometimes it's a little bit shorter, but that's a pretty good thing ballpark to aim for. Whenever we're writing a title, we might start out by putting some things like study about or investigation of, but those aren't important in the title. And those are words that can be eliminated to shorten the length of the title. And some journals will tell you how long your title can be. Typically, they'll tell you how many characters your title can be. Your title will likely be read by thousands. You don't have to be clever, but you do have to communicate what your study was about so that they'll follow up and say, oh, wow, that sounds exactly like what I need for the phenomenon that I'm experiencing. So let me go get that article. Titles are important because they're used for indexing. I'm sure we've all gone in Google Scholar, Scopus, PubMed, whatever, and we've put in some keywords and then the software does its thing and we start getting titles of manuscripts, right? Well, the way that those articles are selected is by the words that are in your title. So you want to use words that highlight the significance of your paper or the purpose of your study. It's better to be specific than it is to be general. So if I'm writing a paper about the action of streptomycin on Mycobacterium tuberculosis, it would be important to put that I'm looking at streptomycin on microbacteria tuberculosis rather than the action of antibiotics on bacteria. It's like, what antibiotic, what bacteria? But if I'm specific, then if a physician is, Google scholaring what sort of antibiotics should I use to combat tuberculosis, then they're going to find your manuscript. And the title, we typically do not use abbreviations or jargon, and if possible, we want to indicate our study design. So here are 2 examples of titles. The first title, way too long, 23 words long. I kind of lose my focus halfway through the title because it's so long. The second one, way too short, way too general. The pandemic, influenza, and pregnant women. When, where, how? Are we talking about the pandemic of 1918, or are we talking about pandemic of last year? And what about pregnant women, right? So we want it to be more specific than something so general like that. So let's talk about some steps that we can use to write an effective title. So I found this activity a couple years ago and started using it in my technical writing class. I've used it in my own writing. I've shared it with colleagues about ways to really think about and develop a really good title. So there are 4 steps in doing this. The first step is to answer the questions: what was my paper about? What techniques or design did I use? Who or what did I study? And what were the results of my study? So you ask yourself those 4 questions. You write down your answer to those questions. Then you use your answers to create keywords. So maybe from the phrase that you wrote answering the question, you pick out 1 or 2 words. Then from those keywords, you build a sentence. And then once you build your sentence, then you go in and you delete all the unnecessary words, such as study of, investigates, anything that's repetitive. Then you link the remaining words and you revise and revise and revise until you try to get it down to like that 12 or 13 word mark. Let's do an example. Step 1, answer these questions. So what was my paper about? What was my study about? So in this example, my study was about whether X therapy improved cognitive function of patients suffering from dementia. What design or techniques did I use? It was a randomized trial. Who or what did I study? I studied 40 cases from 6 cities in Japan. And what were the results? There was an improvement of cognitive function of patients who used X therapy. Okay, so those are the answers to those first 4 questions. Step 2, I take the answers from those questions and I create a list of keywords. So keywords would be things like X therapy, there's a randomized trial, dementia, 6 Japanese cities, 40 cases, improved cognitive function. Okay, that's step 2. Step 3, I build a sentence using those keywords. So this study was a randomized trial that investigated whether X therapy improved cognitive function of 40 dementia patients from 6 cities in Japan. It reports improved cognitive function. 28 words, way too long, but now we can start whittling it down and get ourselves a really good title. Go in and delete those unnecessary words. So this is a study. Take that out. Investigated whether, we can take that out. Reported improved cognitive function. So we can cut this down and get it down to 8 words. So X therapy improved cognitive function in 40 dementia patients in 6 cities in Japan. Get that down, right? Or a randomized trial of X therapy for improving cognitive function in 40 dementia patients from 6 cities in Japan. 18 words. Better. We're doing better, right? Again, we can keep maneuvering it, massaging it till we can get it down to our 12 or 13 words. So the final title for this paper may be that randomized trials of X therapy for improved cognitive function in 40 dementia patients, 13 words, or X therapy improved cognitive function in 40 dementia patients, a randomized trial. I think I like the last one the best, and that's a 12-word rewrite of that title. So that's a process that you can use to get your title down to the appropriate number, but also reflect the importance, the content, and the design of your study within your title. Another thing I'd like to talk about is writing an abstract. So if we think about the flow of a manuscript, right? You have the title, then we have the abstract, then we get into the meat of the paper. Like the title, typically people write the abstract last. You have to write the abstract last. You can't write it until you have written your manuscript. And the abstract is like a mini-me version of the the anatomy of a manuscript, right? You have a little introduction section, you have a little method section, you have a little result section, you have a little conclusion or discussion section. So it mirrors what your paper is. You can take information and cut it and paste it from your manuscript into your abstract. I would strongly encourage that you take your purpose statement that is in your paper and paste it in your abstract and keep it consistent, right? Don't try to reword it or anything like that. Just, this is the purpose in the abstract, this is the purpose in the paper, and it's crystal clear what you are doing in your paper, what the purpose of your study was. So again, the abstract is an overview or a mini version of the paper. You're going to briefly summarize the main sections of your paper. So typically, an abstract has an introduction, materials and methods, results, and conclusion. Depending on the journal where you're submitting your paper, some journals want a structured abstract. So a structured abstract has, you'll have introduction, and then you'll write your introduction, then you'll have a methods sort of like subheading, then you'll write your methods results, write your results conclusion. An unstructured abstract does not have any of the subheadings. You just write it all as one paragraph. Information from your abstract is also included in databases whenever people are doing literature search. So you say, again, you've had this experience, I'm sure, where you say, oh yeah, that title sounds great, and you click on it, and then you read the abstracts, right? So an abstract, a really well written abstract, allows the reader to determine, excuse me, their interest in whether or not they should read your paper. So we want to make sure that our abstract is really well written. Abstracts are usually one paragraph. You know, they range from 150 to 350, but typically they're about 250. Excuse me. So the abstract for the introduction and objectives, we want to state what the problem is, so why your research was done. Why were previous studies not sufficient? Why is a new method needed? What is the impact of your topic, or what is the magnitude of your problem? And then you end with the purpose of your study. So an example, globally, 37 million people are infected with HIV, with adolescents making up the largest percentage of new infections. However, this group is least likely to be tested for HIV and linked to care for treatment and prevention. So the background and the importance of this study. So therefore, the purpose of this study was to examine barriers to HIV testing experienced by adolescents. Then in our abstract, we want to have a method section. So we want to briefly describe what was our study design, what was our sampling or our data collection methodology, what was our sampling site or data collection site, was the time period, how were the samples analyzed, and what was the statistical analysis. We want to include the major aspects of the methods, but we don't want to try to list everything out into detail, right? Again, we have 250 words. We can't be super long-winded in our talking about the methods. For example, this was a cross-sectional examination of data collected through the behavioral risk factor surveillance system survey among adults in the United States between January 1st and December 31st, 2016. Descriptive statistics, odds ratios, and adjusted odds ratios were calculated. 39 words, but I told you the study design, how the data were collected, when the data were collected, where the data were collected, with whom the data were collected, and then how I analyze the data. Okay, so you can be short and sweet, and you need to be, but you need to include all of that information in the methods of your abstract. In the results section, present the major findings. So maybe the most significant findings or the most important findings. Maybe you thought something was going to be significant that you found out wasn't significant in your study, right? So maybe you're going to include that in your abstract. Whatever is the most important findings, you want to include those. Again, you don't want to go on and list a long number of results in that. Then your abstract, you want to conclude. So you want to summarize the importance of the results of your study. So, you know, what is the overall takeaway message from your study that you probably have in the conclusion section of your paper? You can cut and paste and put that into your abstract section. So a few things to think about whenever you're writing an abstract. You want to avoid providing too much detailed information about instrumentation. You don't want to go on about specific details about how the data were collected unless it's critical for understanding. You again, you want to give that important information about the methods, but you don't need to go on and on about the methods unless again it's critical for understanding. Acronyms, typically we don't include acronyms in our abstract unless we're going to be using a word or a phrase over and over again in the abstract. And again, we have 250 words. We need to keep that tight. I'm doing a study on sexual and gender minority people, and I'm going to have that sexual and gender minority 5 times in my abstract. I want to maybe abbreviate that or use an acronym for that. So SGM. So the first time sexual and gender minority, SGM, then use SGM throughout my abstract for the rest of the abstract, again, to cut down on the number of words. Now, if you do that, if you do use an acronym in your abstract, whenever you write your paper, the first time that you're going to use that acronym in your paper, you want to go ahead and say what that is, like sexual and gender minority, and then put the acronym and then use that throughout your paper. You don't want to assume that the reader has read your abstract. You don't assume that. So you want to define what the acronym is in the first time in your paper. So you don't assume that the person reading your abstract has read your paper or vice versa. Most importantly, though, you want to make sure that you do not include any information in your abstract that you did not include in your paper. That's really, really important to remember. And I think that is that. So I'm going to turn it back over to Dr. Batra to talk about the Smarty.
Wonderful. Thank you so much, Dr. Farr. And I'm sorry I had to turn off my camera to help with the bandwidth because I was getting messages that my internet connection is not stable. So we have like today audience, including like resident physicians and nurses and health, like public health students, faculty. So I'm thankful to all of you who attended this seminar. So let's do one exercise and how we can apply this knowledge to our practice, not only clinical practice, but also like when we write the paper. So I will ask few questions from all of you, and just to make this discussion engaging. So how many of you, when you write your title of the study or the manuscript, how many of you think about STROB guidelines? Just you can unmute yourself or you can just write in the chat. So while you are responding to my question, I would say that it's really, really important for us to follow the guidelines. So there are some guidelines in terms of like whenever you are doing observational study, you will follow the STROB guidelines. And one of the guidelines in the STROB guideline is stating that whenever you are writing the title of your manuscript, you have to indicate the study design in the title. So that is one of the guidelines. And how many of you are aware about CHAMP statement? So CHAMP statement is the checklist for statistical assessment of medical papers. So basically another guideline, which are fairly new, that gives you a checklist of the items that you would like to address in the method and the result section. That is another thing. And I would also like to say about few things in abstract writing. As Dr. Farr mentioned, that abstract should be able to stand alone. And that is critical because whenever you submit your manuscript to the journals, editors, they majority of the times, they look at your abstract. They don't read the entire manuscript. So whatever decision they take, whether it should go for desk rejection or the review process, they look at your abstract. So your abstract should be a concise summary of your purpose statement, of your method section, of your main findings that you would like to highlight, and some implications. So that is really important for us to remember. And other thing is there should not be any references in the abstract. So a couple of times I get this question from my mentees who ask like whether we should include references in the abstract. The answer is no. We should not include references in the abstract. Other thing that I would like to state here is the keyword. So whenever you are choosing the keywords, for your manuscript, make sure that you are choosing those keywords from mesh words so that it is searchable in the PubMed. So your article get more citation because of those keywords. So that is also important. I would also say something about method section. Every time I get one question from the from different learners here. Is it ethical to submit two papers using similar methods but different materials and application? What you all think? Is it ethical to submit two papers using similar methods, considering that method cannot be written in so many different ways? For example, if you have done univariate or bivariate or multivariate, there are a couple of ways that you can, paraphrase this information, but at the end, it's like method, right? You have to give all the information. So majority of the times, if you are querying the same data, and then producing different manuscripts out of it, I think it happens like you will have some redundant information in your methods. So what are your thoughts about it? If I just would like to open this floor for this discussion, if you want to have any discussion on that. And also, method should be very clear, as Dr. Farr already mentioned. It should have all the aspects so that your study is reproducible. So other researchers who want to replicate the study in different location, they would say like, okay, these are the methods that researchers have followed. Nowadays, journals are asking about sample size justification. So you might consider adding that subsection in your method, like how you came up with the sample, and also assumption testing. So whenever you are writing your statistical analysis portion, you can also talk about little bit about your assumptions, like before even how you selected your statistical analysis portion. So I think these were some key points that I wanted to mention, which Dr. Farr already covered in her presentation, but I was just wanted to emphasize that. And I see a few things in the chat from Courtney Warren, who said, as long as it is clear that data set appears in another paper, it is okay to have the methodology. That is correct. So if you are citing your paper and you can say that additional details can be found in our previously published paper, or maybe you can direct people to others. I also see one response from Anna Reyes, who said, yes, I think it is ethical. I know sometimes people have been asked to cite themselves. So other than that, I don't see any questions. Molly, do you see any question? Because my internet connection is behind. So do you see any question in the chat, which I didn't see?
Nope, you answered all of the questions and comments that were listed.
And can we go to the QR code slide so that our audience can take the survey?
Can we unmute and ask a question?
Yes.
Yes.
Okay, thanks again, Dr. Farr. This was fantastic. I did take your course, which I have to say, in my PhD program, this is one of the best courses that I had. Extremely practical for writing, but not only writing, but peer reviewing. Being trained how to be a peer reviewer is so important. So I'm asked quite a bit to be a peer reviewer. And of course, my articles have been peer reviewed. But how do you deal with a peer reviewer that goes against these guidelines that you've just talked about?
Yeah. So whenever we're responding to peer review, it's not that, and I think people feel compelled, like that they need to do everything that the reviewer told them to do, or I suggested that they do. But you don't necessarily have to do that as long as you can provide a good justification about why you didn't change your manuscript in the way that the reviewer had recommended that you do it. So maybe if the reviewer says something like, that you shouldn't have included so much information about your inclusion exclusion criteria, you can say, thank you for that comment. However, based on, the stroke guidelines or something like that, that you feel strongly that you need to include that information. So you can always fall back on the thank you for that comment. However, because of X, Y, and Z, I'm going to include this information in my paper. Sometimes they'll make comments that don't make sense. Sometimes they'll make suggestions that aren't physically possible to do. And so it's important that you read that information, you consider it. However, you can just tell the editor, that this was a good suggestion. However, this is the reason why you didn't do that. I'd like to also highlight, Dr. Botcher talked about the strobe guidelines. That's a really good way. And some journals have even gone to the point where they require that you have the strobe guideline and that you put on the Word document of the strobe exactly what page and line numbers you addressed each of the different things that are required in the strobe guidelines. And they're really, the title and the introduction don't have a lot, but the methods has a lot of information that you should be including. And so I think that's a really good thing. And I try to follow in my writing that I have the strobe guidelines out, and I make sure that I've talked about, what is the sample? How did I do the statistical analysis? What were my variables? How did I try to eliminate bias in my study and things like that? So the strobe guidelines are really, really useful whenever you're writing a methods section.
Thank you.
Dr. Ford, do we have QR code in your slide deck?
Yes. Are you able to see that?
Yes.
Okay.
Oh, it's gone.
Did it go away? I'm sorry. Let me pull that back
No
up.
worries, no worries. So
Nope.
there is one link in the chat. If you can please take the survey, everybody, please take the evaluation survey so that we would know what future topics you would like us to cover. And there is a QR code as well, which you can scan and take the survey, and you can download your general certificate of attendance or CME, whatever pertains to you.
Okay, now can you see it?
Yes.
Okay,
Thank
great.
you.
Mhm.
I will just keep it for a few minutes for everybody to scan the code, or if you want to use the link posted in the chat. Meanwhile, if anybody has additional questions, please feel free to unmute yourself and ask questions.